When I went into hospital, I really didn't know what to expect. I'd never had any surgery at all. And actually, initially, my fears were about the operation rather than the kidney cancer itself. What I would say is that the operation itself is major, but for me, it wasn't quite as bad as I thought it was going to be. In terms of going into hospital, there's a really useful list on the Kidney Cancer Support Network.
I was really prepared. I had quite a long time to prepare because my surgery was complicated by the fact that I had a heart condition. And I'd done things like I'd researched my surgeon in advance. I'd looked up the procedure I was going to have. I'd even looked at YouTube videos of the operation. So I felt prepared from that sense. And then practically I'd done things like I'd packed a bag for every day I was in hospital with clean pyjamas in it and magazines and things like that, because I knew if I left it to my husband, I'd end up with my granny's nightie from the bottom of the drawer. So.
I had a radical nephrectomy, and it was an open radical nephrectomy, which is a big operation. And the reason for that was that the tumour was 7 centimetres and not in a very good place. It probably took me about 6 weeks, I would say, to recover. It was probably nearer 6 months before I was really completely back to normal, although I was living a normal life during that time.
The type of surgery I had was open radical nephrectomy. The tumour, wasn't a particularly big tumour. I think it was 4 centimetres or something from memory. She just felt, because of the positioning of it, where it was positioned, it was impossible for her to do anything else other than that type. Possibly nowadays, because it's 12 years on now, I think things have changed quite dramatically since then, so it might be partial laparoscopic now, but I think back at the time that's what she felt she could deal with. Well, I was actually in hospital for about 4 days. I was sort of up and walking within 3 days, which absolutely, I was gobsmacked with how quickly you kind of recover. I think it was all such a blur. I didn't think there was any way of sort of questioning it. I didn't think that I could probably have a second opinion or, go and get advice anywhere else. I just sort of did as I was bid. And I think that's probably what I'd advise anyone is, even if you trust, because it's not about trust really, it's just about giving yourself some comfort. So, go and ask the questions if you have got any.
I had a full open nephrectomy, so that's at the most major end of the surgery. My tumour actually extended into my inferior vena cava, which is the big vein that goes back up to your heart. So my surgery involved cutting from my breastbone down and then out in what they call a Mercedes-Benz.
He saw me, he said, yes, we've got something that we're going to, on your 2 tumours on your kidney, that we're going to take out along with the kidney because of the size they are. They were sort of 4 centimetres and 7 centimetres. And afterwards they'll be biopsied. It was presented as this is the decision. And it didn't occur to me at all that I should have a say in that process.
When I had my operation 13 years ago, there was probably very little information provided. I did Google as I wanted to know what I was up against, and I found the good, the bad, and the truly terrifying. And that was not probably a very good thing to do. But for me, knowledge was very important. I wanted to know what was happening, and that was something that actually helped me cope, that knowledge.
I think so on balance. They didn't provide very much, but I still think it was enough. There wasn't anything I really needed to know going in. I could have been maybe advised that the recovery from the operation would be a lot longer than perhaps I thought it would be. It was a matter of a couple of months before I was right again.
My hospital did tell me about what the surgery would involve. They had explained that it was a major operation. They did actually have a guide to having a nephrectomy on their website, so I had read that information in advance.
I wasn't given any leaflets or any information. I just sort of turned up, sat down, and that was it. My information was all from the internet, basically. And ultimately, when I'd spoken to my oncologist, I got a fair amount of information from him post-operatively.
It was biopsied at the time. The material was taken out, biopsied, and then I had a consultation with the urologist. About 3 weeks later, the urologist confirmed that it had been confirmed as kidney cancer, and that he was recommending I be treated, and that it would probably involve a course of immunotherapy, which gave me a word to look up because I wasn't familiar with immunotherapy in 2010. It's fairly new then.
The tumour was analysed, and I got the results of that about 6 weeks afterwards at my the appointment post operation. I wish I'd known a little bit more about what the results meant. I was given the pure numbers, the grade, and the type of cancer, which is everything you need to know. But what I didn't know at the time was what they really meant, and that's the information that would have been more useful to have.